welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. Today in Wellness Watch, we discuss cancer. What is cancer? How does it spread? Why is cancer dreaded? And what are the treatment options? Have these questions ever hit you? If yes, then stay with us for the next half an hour. We will explore answers to these. I'm your host, Preeti. Cancer, one of the deadliest diseases, yet often detected too late. Fear, stigma and lack of awareness prevents many from seeking timely medical help, making survival an uphill battle. But with advancements in treatment and the power of early detection, hope is stronger than ever. From revolutionary therapies like immunotherapy to the importance of a healthy lifestyle, the fight against cancer is evolving. Awareness and prevention remain our best weapons. Here's a report by DD India's Harshita Oberoi.
Cancer is a disease in which certain cells of the body grow uncontrollably, forming a lump or mass, but not always. A silent enemy like blood cancer does not create lumps. As these abnormal cells multiply, they begin to invade organs, spreading their damage across the body. And in India, a heartbreaking truth. Most cases are diagnosed too late. Fear, shame, and negligence delay treatment, making survival an uphill battle. Among men, lung cancer and head and neck cancers are the most common. Among women, breast and cervical cancers take the lead. A lump, a sudden change in the breast, these could be the warning signs. Family history, age, tobacco use, these are the major risk factors. And yet, hope lies in early detection. A simple biopsy can confirm the disease, giving patients a fighting chance. For decades, treatments like chemotherapy and radiation therapy have helped patients fight cancer. But now, a revolution in medicine is changing the way we treat this disease. A new warrior has emerged: immunotherapy. Unlike conventional treatments, immunotherapy empowers the body's own immune system to recognize and destroy cancer cells. White blood cells, proteins, and tissues, these natural defenders are strengthened through cutting edge medicines. This revolutionary treatment is now being used against lung cancer, cervical cancer, breast cancer, liver cancer, and many more. Yet, beyond medical advancements, the best defense is prevention. A healthy lifestyle is a powerful weapon. Regular exercise, a diet rich in fruits and vegetables, and avoiding tobacco and alcohol can significantly reduce cancer risk. Processed foods, obesity, and a sedentary lifestyle fuel the disease. Vaccinations for HPV and hepatitis B provide added protection. The message is clear: early detection can save lives. And with advancements in treatment, the war against cancer is seeing new victories. But awareness, prevention, and timely action remain our most powerful weapons.
The fight is tough, but hope is stronger. If detected early, cancer can be treated, even defeated. Speak up, get checked, and take charge of your health, because every life is worth saving. Harshita Oberoi, reporting for Wellness Watch, DD India.
All right, the chances are that you already know or will know somebody with cancer. 4th of February is observed as World Cancer Day. Cancer is the second most common cause of death worldwide. About 1 in 4 people tend to develop cancer at some point during their lifetime, but fewer people are now dying of cancer. That was experienced, say, 20 years back. Early detection and innovative treatments are curing cancer and helping people with cancer live longer. Today in Wellness Watch, we ask the following questions. Up on your screens, we try to explore: how does cancer start? How does it grow and spread? What are the different stages or grades of cancer? Are there any prominent symptoms? And we also explore the medical advancements in India. All right, the basic idea of the show is to acquaint you with medical innovations and advancements in India with regard to the ailment or the disease we pick every week. And talking of cancer, radiation therapy, cell-based immunotherapy, gene therapy. Also, these are the prominent treatments when we talk of the medical options available in India. Up on your screens, we have some of the institutes, some of the hospitals which provide world-class and reliable treatment for cancer in the country. All India Institute of Medical Sciences, Delhi, Tata Memorial Cancer Research Centre, Mumbai, the Gujarat Cancer and Research Institute, Ahmedabad, Postgraduate Institute of Medical Education and Research, Chandigarh. To throw more light on cancer and help us understand it better, we're joined in by guests today. We're joined in by Dr. Ajay Gogia, Professor, Medical Oncology, AIIMS, Delhi. And we're also joined in by Dr. Navin Khattry, Deputy Director, Tata Memorial Cancer Research Centre, Mumbai. Dr. Khattry is joining us virtually. Thank you both of you for joining us this afternoon on Wellness Watch. Dr. Gogia, to begin with, I would want you to explain to our viewers who gets cancer, because we know it is awareness that goes a long way in helping people, fight the battle against cancer. But to start with, who gets cancer?
So there is no definite prediction about the cancer, in which patient to get the cancer, because there is no prediction except the hereditary cancer, which was usually breast and ovary. So there is no perfectly prediction, but patient whom are exposed to risk factor like tobacco, smoking, alcohol, overweight, obesity, or polluted environment, they might get the more chances of cancer, but there is no practical guidelines, or there is no practical risk factor which patient go to cancer or which is not, but definitely hereditary is one of the factors.
All right, Dr. Khattry, how does cancer grow and spread in the body?
Good afternoon, Preeti. Thank you for having me here. So, cancer usually starts with one cell becoming abnormal in a tissue. And once it gets a bit abnormal, then it starts proliferating. That means it starts multiplying. And, the check and balances of a normal cells are no longer there. So then it keeps on multiplying. When it grows, then the blood vessels which are surrounding the tissue, by that it starts spreading to the other areas. So in a nutshell, it is a cell which goes abnormal because of genetic mutation. After that, it loses the checks and balances of a cell so that those cells don't get destroyed. And after that, it starts growing out. Some of it dies, some of it goes into the blood vessels, and from there it starts spreading to the other areas in the body.
All right, Dr. Gogia, cancer, when you talk of cancer, this cancer is not just one disease or one ailment. There are, many types of cancer, more than 100 types of cancers. But then for a patient, what are the early symptoms one should look forward to when we talk of cancer?
So it depends on which is the primary site of cancer, because all of the cancers are different sign and symptoms. For example, like in India, around 15 lakhs of cases of cancers per year, and the most common cancer is breast cancer, which constitute around 15% of cases. So breast cancer is definitely present with a breast lump. Painless breast lump is the most classical symptom for breast cancer. The second cancer is again head and neck cancer, which is usually present with the ulcer or any growth or any lymph node enlargement. Number third is cervical cancer, which is present in the discharge or bleeding in the upper vagina area. And the fourth is endometrium cancer or any gynecological cancer, which is present with the DUB, disparate uterine bleed. So depend on which is cancer, which specific kind of cancer, and which is the presenting symptoms. Like blood cancer usually present with the bleeding manifestation, fever, or low platelet count or low counts. So depending on which site of cancer, the symptoms depending on that cancer. For lung cancer, it hemoptysis, cough, and among all, the weight loss and fatigue is the most common center which is contributing to each and every cancer.
All right, so the basic starting symptom is fatigue, tiredness, but then I'll take that forward to Dr. Khattry. Sir, this is something which we face regularly in our day-to-day lives, given the fast-paced lives we are leading. What are, sir, explain to us the symptoms, but then when is it that cancer becomes incurable? What are the different stages? What are the different grades of cancer? Is cancer always detected when it is incurable?
So, the most important thing is the awareness of people that if there are some symptoms which linger on for few weeks, then one must go to the doctor to find out what is wrong with that with that person. So as Dr. Gogia said, that for a breast cancer patient, if there is a lump which is persisting for a few weeks, then the lady should go to the doctor to find out what is wrong. Similarly, in other cancers like the oral cavity, if there is ulcer in the oral cavity or there is inability to eat food properly, obviously there is something wrong in that area and one must seek medical advice. Now the stages of cancer depends whether it's from a solid organ or the blood cancer. So in blood cancer, usually you don't have stage, it's always in the blood. So there are other factors which govern the outcome, but in solid tumor cancers, suppose like of the breast, of the cervical region, of the head neck region, there are stages which mean that the first stage is only when the organ is involved. The next stage is when the surrounding other tissues, that is the lymph nodes, get involved. And then after that, when it becomes when other tissues get involved or when it goes to other areas of the body, suppose from the breast it is going to the bone or to the liver, then it becomes stage 4. And most cancers are incurable when it reaches stage 4. A lot of cancers are cured if they are diagnosed within the first or the second stage by surgery, radiation and chemotherapy.
Dr. Gogia, is cancer genetic?
Yes, among all cancer, around 10 to 15% cases are hereditary.
Okay.
So,
all right. 10 to 15% of cases are hereditary. But then, talking of the treatment, Dr. Khattry, help us understand how does cancer treatment work? Because finding a cure for something that is continuously evolving is indeed, is an uphill task. So help us understand in common man's, language, in very simple terms, how does cancer treatment work?
So, it depends whether it's a blood cancer or is it from one of the organs. Now, the 3 pillars of treatment of cancer for the last 80 to 100 years remain surgery, radiotherapy, and chemotherapy. For many of these solid organs, suppose if it is of the head neck region or the breast region, depending on which organ is involved, surgery remains the cornerstone of treatment if it's in the earlier stages like stage 1, stage 2. So first you remove the whole tumor and with a bit of a surrounding tissue and some other areas so that in that area hopefully the disease will not come back. But when you remove that tumor from there, many times the disease may have also gone to other areas which you may not know because you don't have the tools to understand whether other organs may have been involved or not. The sensitive tools may not be there. So for that, there are 2 things that are done. For the local area, you give radiation after surgery in some cases, and in most cases, then patients receive chemotherapy. Now with this, I would say half this cancers would hopefully have a 5-year survival of more than 50 to 60%. That means most patients will live at least 5 years without disease if detected early. Now when that stage is stage 4, that means other organs get involved, then usually chemotherapy remains the backbone. Now you just stated some time back of immunotherapy.
Yes.
So with the immunotherapy, what is being what advancement has happened in cancer in the last decade or so is that we've understood that our lymphocytes, that is the T cells, are very important to kill the cancer. And various immunotherapy which exploits these lymphocytes are then given, at least in the advanced stages, to cure it, not to cure it, but to improve the survival to some extent in the solid tumors. In blood cancers, chemotherapy remains the backbone. Immunotherapy is used in some of those patients, and bone marrow transplantation is used in another 30% of blood cancers, such as acute leukemia, to cure the patient.
All right, we'll talk more about it. But then, Dr. Gogia, to what extent does lifestyle or the ways of living of a person, to what extent do these play a factor in a person getting cancer?
So, because most of the cancer is now considered as immunogenic, so most of the lifestyle modification or healthy lifestyle or walking or exercise, yoga, meditation, it will help to increase the immune system by various ways. So, if we improve the immune system, then it will again prevention or protect the cancer cell to grow. So, meanwhile, all the preventive strategy like good healthy style, like avoid all the oily stuff or any non-vegetarian to burger, pizza and different Western style modification we are adapted. So, we can avoid these Western style adoption, sedentary lifestyle, or increase our body activity by yoga or meditation or any exercise. It will protect definitely cancer by the immunogenic ways, and we have good Indian diet has very good source of antioxidant like turmeric to curcumin to each and everything which protect the cancer if we consume our diet in regular and healthy way.
All right, Dr. Khattry, are vaccines available for cancer?
So, vaccines, one is to prevent infection. And because some of the infections cause cancer, and the two most important are the hepatitis B and C for liver cancers and for HPV, that is human papillomavirus, for cervical cancer. So there are vaccines which most children take at the young age for hepatitis B vaccine, and for HPV now there is an immunization program which is across the world to give young children at the age of 10 to 12 HPV vaccine. So these two strategies prevent the development of cancer in a large majority of people. However, cancer vaccines to treat cancers is something which is the area of intense research in many parts of the world. However, we've not really cracked the code to be able to treat cancers with vaccines as such till now.
All right, Dr.
So it
Gogia.
is basically used for prevention.
Okay. Dr. Gogia, vaccines are used for prevention, but then I would want you to acquaint us with what is the rate of prevalence of cancer in today's times. How frequently, are people affected by cancer, are getting cancer in today's times?
So, as you already said, the cancer is now rapidly increasing. Rapidly increasing, the rate of growth is so much so that initially the cancer is third or fourth most common cause of death. Now, at the present time, it is second most common cause of death. The reason being the prevalence of cancers is so much rising because of we tend to younger age, usually present in a younger age with so many lifestyle modification and so many stress factor and environment factor. But the thing is, now the patient is present in younger age and in advanced stage. So as such, that stages is advanced, the prognosis is very poor. But the advent of newer target therapy or immunotherapy or sometimes personalized medicine, this the prognosis of cancer is relatively better than the past. Like in past, the 5-year survival rate in lung cancer in stage 4 is 20%, but now is 40% 5-year survival rate because of personalized medicine, because of target therapy and because of immunotherapy. Same hold true for the breast cancer. Now last 10 years back, the 5-year survival rate of breast cancer is 20%. Now it is 50%, depends on the how the immunotherapy and target therapy works with the personalized medicine and other advances in the breast cancer and lung cancer.
All right, also acquaint our viewers with the medical research, or for that matter, the medical advancements that are being made across the world. And we'll specifically also talk of where India stands on the global page. Both of you, Dr. Gogia, first to you, what are the medical, where is cancer research at present standing, and what are the medical advancements when we talk of cancer treatment?
So first, the medical advancement in respect to India is the advancements in artificial intelligence in the diagnosis and prediction model for cancer. So artificial intelligence in a big way for the diagnosis and prediction for the cancer. Second is CAR T cell therapy. Now is every center, or more than every center in the India, even in Delhi, the CAR T cell therapy is a kind of immune modulation is very rampant for the different kind of cancer like acute leukemia, lymphoma or myeloma. And third is liquid biopsy. It's a very upcoming way for liquid biopsy to incorporate in the management of cancer, where the only blood sample make the diagnosis and treatment. And the fourth is immunotherapy. Most of the time immunotherapy works very well, suppose in lung cancer, suppose in GI cancer, and one of the report shows only immunotherapy works in the rectal cancer, which makes avoid all of the radiation and surgery is avoided. So the advancement in the form of artificial intelligence, precision medicine, we treat all the cancer, especially in lung cancer, only one target, hit and cure the cancer. So depending on the which cancer, which tumor, which precision oncology, which liquid biopsy, which artificial intelligence, immunotherapy and precision therapy, and now the target therapy cost is very low. So even in the case of suppose breast cancer, if the patient is HER2 positive, only target therapy works better. So it depends on the precision medicine and rampant use in India. And it definitely helps the patient because we can avoid chemotherapy or chemotherapy induced side effects.
All right. Dr. Khattry, would you also add to this?
Yeah, Dr. Gogia has already very nicely stated all the advancement. Just to add to what he has said, I think one of the most I would say technologically advanced strategies which have come is immunotherapy at large, with CAR T cell therapy for not only blood cancers, and it's also coming in solid tumors. And in India, IIT Bombay and Tata Memorial Center were the two institutes which came together to make the first indigenous CAR T for acute lymphoblastic leukemia, which is one type of blood cancer, and lymphoma, B-cell lymphoma. And with that, it has opened the gates for many academic as well as industry partners to come together to further lead to innovations in CAR T in India. But not only that, a lot of targeted therapy, which is now the important way of treating cancers, is by manufacturing antibodies, which again targets one of the proteins which is unique to the cancer cell and not to the other normal cells of the human body. And these antibodies, which are usually monoclonal antibodies, which may also involve the lymphocytes for killing the cancer cells, is another area of technological advancement in the world for treatment of cancers. And India is also gearing up for such advancements. And this will certainly be a boon to our country, because we will be able to manufacture such therapies at a fraction of the cost which is available to the Western world.
All right, Dr. Gogia, you talked about lifestyle changes, you talked about diet, to what extent it plays a role, but to what extent does sleep of a person play a role in a person getting cancer?
The sleep?
Yes.
Definitely is it's mandatory depending on the profession. 6 to 8 hours sleep is very important, because if you've slept appropriately, there is no accumulation of all the antioxidant and would cause the cancer. Again, lack of sleep again develops stress and again is the addictive lifestyle for coffee and tea, which will lead to again unhealthy lifestyle. So sleep is definitely, yes, is very important, along with I said already,
Yes.
good healthy habits or healthy foods is very important to protect
Healthy
cancer.
ways of living coupled with good sleep are the key to a good life also. But then now we will have a quick rapid fire question round, a kind of a myth buster round for our viewers to get their myths cleared. Dr. Khattry, is cancer always fatal?
No.
Dr. Gogia, eating sugar makes the cancer worse. Is it so?
It's not exactly.
Dr. Khattry, can herbal products cure cancer, treat cancer?
Well, it has to be done in good research to find out, but they, yes, could be an area where it can be used.
Dr. Gogia,
But it's not proven.
Yes, yes. Dr. Gogia, if nobody in the family has had cancer, does that mean that a person is risk-free?
No.
Okay. Dr. Khattry, a needle biopsy can disturb cancer cells. Does this cause them to travel to other parts of the body as well?
May, but for most areas, the biopsy is important to diagnose.
All right. Dr. Gogia, everyone who has the same kind of cancer gets the same treatment. Is it so?
No, it depends on the overall condition or other comorbidities. This is not definitely the same treatment for every patient on the same stage.
All right. With that, we end this edition of Wellness Watch here. We end this discussion here. Thank you so much, both of you, for joining us and helping us understand cancer better and what all medical advancements, medical treatments are available in India. Thank you, both of you.
Thank you.
Thank you. Thank you very
All right,
much.
so we had a wholesome discussion on cancer. Having cancer is a life-changing event. Knowing what to expect from diagnosis to recovery can empower you and help you take control of your health. At least 1/3 of all cancers can be prevented through a combination of healthy lifestyle and regular screening. Raising awareness and encouraging action can empower people to protect their health and detect cancer early. Remember, you can be a victim of cancer or a survivor of cancer. It's in the mindset. After all, the human is stronger than anything that can happen to it, isn't it? On that note, we end this edition of Wellness Watch. Till we meet next, take good care of yourselves. Bye-bye.